You good?
Yeah.
So basically we're going to talk about running injuries today, which as many of us as runners are going to experience some of these in the course of our training and running these races. It's good to know a little bit about them and of course how to treat them and prevent them. So just a brief intro to running. You know, running is very popular. Everyone learns to run as a child. That's where we form our basis for running. Our legs learn how to run without somebody sitting there and teaching us like in a classroom. Running is a relatively inexpensive workout comparatively to getting gym memberships and Pilates instructors and all the other things that are out there. So it is still pretty popular and getting more and more popular. If you look at U.S. marathon finishers overall, it's been, ever since in the last 10-15 years, it's been up and up and up and continues to rise pretty much every year. It's also interesting that it's a sport that all ages participate in. If you look at the New York City Marathon splits over the years, we've got lots of people that are running these races, basically, I guess I'll work on here, in their 30s and 40s, which is unique for many sports. Baseball, soccer, all these other sports tend to have much younger participants than the marathon, which is a much older crowd. So we'll talk just quickly about injury principles. Pretty much everybody wants to get from here, which is the start of the no longer ING, but now the New York City Marathon, and wants to get to here, which is that finish line. And what people look like if you have not been here. These guys look pretty good. Some of them don't look that good. And we don't want to end up in here, which is one of our medical tents where we staff the medical volunteer staff and tries to put people back together again when they have problems. And we really don't want to end up in here, which is what ends up happening if you get sick enough, which is rare. Biomechanics of injuries, most running injuries are not related to trauma. So unlike biking and Tough Mudder races and all these other kind of races, these are not traumatic events. Even in New York City with taxi cabs and bikers in Central Park, most of the running injuries we see are going to be overuse type injuries. So most of our injuries are related to damage that's caused by repetitive stresses, cycling the knee back and forth over and over again in the course of running. So these are very different injuries than are sustained in, say, football players or baseball players or people that tend to get in sports that are involving some type of contact. The forces are very high over the lower extremity of the knee. It sees up to 7 to 10 times body weight during the act of running. The tibia bone sees compression of 10 to 14 times your body weight. Ankle, Achilles, all are receiving excessive stresses across there. And it's basically our body's ability to adapt to these stresses that lets us run. Sometimes that doesn't work so perfectly. Running is a great amplifier of any kind of minor abnormality. So all of us have some tightnesses and weaknesses and even some alignment issues that really don't give us any problems for day-to-day activities. Walking down the city streets, even doing basic sort of mild activities, really you're not going to see any problems with this for most patients, most people. But unfortunately running, by the nature of its cycling the knee and ankle and everything else, tends to sort of amplify these problems. So that's kind of an important point for many people to remember, is that there is oftentimes something that caused this, but it's not really the running that did it, it's the running that just aggravated it. So the theory behind injuries is that basically for every activity we do, whether that's walking down the street, whether that's biking, swimming, or our favorite activity, running, there is a threshold level at which our body can self-repair it, where basically we are constantly stressing our body, but it's getting healed as we go. So as long as you stay below that, and in terms of runners, we look at miles per week as kind of an easy way to sort of figure this stuff out. So if you exceed that level, so you've gone from 10 miles a week to 20 to 30 miles a week and your body hasn't gotten a chance to adapt, that's where you get an overuse injury, and that's where we get into trouble. So lots of different things can play a part in this. Genetics is a major factor. Some people have the capacity to run and never get injured. Some people do not. Some people have low threshold, some people have high, and that's something that's sort of innate to who they are. Now, as we get older, periods of inactivity where we haven't been running or doing other activities, or any kind of illness can all act to decrease the threshold. So even if you're used to running 40 miles a week and you get a bad flu for a couple of weeks and then go back to running 40 miles a week, a lot of times you've lost some of that ability to adapt, and that's where some people get into trouble. And unfortunately, as we get older, that tends to occur as well. So training, which is what we all know about, is basically slowly increasing our mileage, staying beneath the threshold, and the threshold goes up and up and up, which allows us to do things like run 26.2 miles, which most people, if they try to do that from getting off the couch, would get into some serious trouble. So that's the whole theory behind avoiding injury, and it's also involved in how we treat these. So the important thing to remember is that the threshold does decrease following an injury. So if you've been running 20 miles a week and bump it to 30 and get injured, if you go back to running 30 miles a week after the injury has, quote, healed itself, a lot of times you're back into the same place. So this actually goes down and you're back to sort of a lower level. And again, when you're recovering from an injury, it's important to understand this so that you don't repeat the same mistakes again. So the main priority for recovering from an injury is allowing that activity to slowly ramp up so that we're still beneath that level of the threshold. Now, unfortunately, none of us have like a threshold meter. There's not like a device on our iPhone that can tell us exactly what that threshold is. Someday maybe there will be, I think. But right now there's not. So basically it's something we all have to kind of figure out, and that's, again, very personalized to what your training and your level of competition is. So rest, which is what we talked about, at pure rest, we know if you're not running, then you're definitely below the level of the threshold level. The problem, obviously, is that it's troublesome to maintain a specific schedule if you've got a race coming up like the marathon. So cross-training, that's another way where we can recover from injury by maintaining some of our fitness level, but at the same time giving our legs a break from the running forces that have been causing the injury. So cycling, swimming, elliptical machines, they all, if you're a runner, tend to be kind of boring and painful, but at the same time they can be a good part of a recovery from any injury. And the important thing that we as doctors like to at least know about is that runners like to run, so it doesn't matter the weather, whether it's cold, wet, snowy, whatever it is. Many of us would like to run, get out there and do it, whatever the cost and whatever the I guess situation is. And if you don't really understand that and just tell people don't run, that's not really the right way to treat them. So part of what we do is try to figure out how to get people running back again without just going cold turkey on it. So in terms of preventing injury, obviously don't overtrain is the #1 rule. That is a very, again, individual thing that not everybody can figure out for themselves. But you want to increase your running distance, your pace, your frequency at a level below the threshold for injury. There's a 10% rule that people throw around that you'll hear all about. It makes perfect sense if you're running 20 miles a week to bump it up to 22, to bump it up to 24, to slowly work your way up. It doesn't make a whole lot of sense if you're running 10 miles a week because then you're bumping up 10.1, 10.2. It takes you too long to get up there. But that's the rule that people throw around, and again, it doesn't really work for everybody, but it's something to kind of at least gauge where you are. So if you're running 20 miles a week and you bump it up 8 miles to 28 miles a week, then perhaps you realize that you're doing something that's a little bit beyond what the usual is. Other things for injury prevention, building up leg strength is certainly important, especially for knee problems. Running, it doesn't make sense, but it doesn't really build strong knees. It does build muscles, but it doesn't balance the knees out. You end up with sort of asymmetries. You end up with hamstring muscles, glute muscles, and calf muscles that are super, super strong, and quad muscles that are not that strong, and muscles in front of the knee that are not so strong either. And this sort of imbalance can actually create problems and can create pain as we start to get into heavier mileage training. So it's important a lot of times to get to the gym. You know, I do these marathons also, but I still try to work out at least twice a week at a gym. And a lot of what I do is working out on my legs, which doesn't make much sense if you're a runner, but building up strong legs can help you a lot to prevent injury. Core strength, super important. If your core is weak, then basically what you're asking your legs to stabilize your body as you run. So if your legs are having to stabilize your body, then they are not doing what they're supposed to be doing, which is propelling you forward and getting you up a hill or through a race. So core strength is not only protective, but it's actually good for performance. And if you look at a lot of the elite athletes, they spend a lot of times doing core workouts in addition to their running. You're not going to see them at the gym putting 6 plates on a bar and doing bench press, but you're going to see them doing a lot of ab work. You're going to see a lot of these kind of core exercises that can be very helpful for both preventing injury and making you more efficient as a runner down the road. So stretching, we've all heard about it. We all do it to a certain extent and probably don't do it as much as we should. In my opinion, it's certainly important both before and after runs, and even on the off days that you're not running, it can be helpful. And this definitely, calves and hamstrings tend to be the more important of the bunch. They are the ones that tend to be the most, affected by tightness and the ones that are more commonly injured. And those stretches are the ones that I tend to focus on. Probably we'll hear from the finish line folks about some techniques on that as well. Something that's very helpful is to vary your terrain and try to include some soft surfaces. If you're running a marathon, then it's going to be pretty much all on pavement unless you're doing some sort of crazy trail race. So you need to incorporate some pavement into your routines in order to get your legs used to that. But mixing and matching, getting some soft stuff in there can be helpful. If you train in Central Park, you can do what I do, which is spend lots of time on the bridle path, on the reservoir, but then get onto the North Hills and onto the South Loop. So you're mixing it up, getting some hard pavement, but as well as some dirt too. And treadmills. Treadmills, people think treadmills are super safe because they're soft, they're cushy, they seem like they're really nice. But at the end of the day, if you're doing heavy mileage on a treadmill, what you're doing is you're basically putting the exact same forces across your legs in the exact same fashion every single step you take, which is relatively unique for any kind of activity that we do. When we run outside, we're dodging potholes and squirrels and crazy dogs and bikes and whatever, and that is actually, has some variety effect on the legs, which is a good thing. But treadmills, the only way to change what you do is to either, play around with the machine a lot or end up falling off the treadmill by trying to run in a funny fashion. So I think, in general, treadmills can be an effective part of anybody's training, but it needs to be kept to somewhat of a minimum when it comes to long-distance training. There are people that do it. I have patients come in that tell me they trained only on a treadmill for a marathon, but I think that's very unique, and I think it tends to be pretty dangerous. Most people can't get away with that. And it's important to keep some rest days as a part of any schedule, which is important if any minor injuries arise, to give your legs a little break to sort of keep it up. Running 7 days a week, even if you're doing 2-3 miles a day, still is not the best way to train for this stuff. Well-fitted, updated, appropriate shoes. There's been a whole, surgence towards minimalist shoes. Now we're back to sort of more maximalist shoes. My opinion is that it's, in general, that most people benefit from a well-padded, just a decent running shoe, nothing crazy with a minimalist approach, not necessarily the biggest shoe in the bunch, but something in between. Hydrating well is really important. It's important not to get sick. It's important not to end up in the emergency room, but it's also important for your muscles. If you have a lot of dehydration and have losses of potassium and sodium that you're not correcting as you run these long distances, that actually can create injury because the muscles just don't have what they need to be safe, but also for preventing injuries too. Good nutrition, getting calcium and vitamin D in your diet, super important. Most people are getting reasonable diets, but as we start to increase our running, it's putting more stress on our bones and making sure that we're maintaining adequate stocks of both calories as well as vitamin D, and calcium is super important. You want to make sure you're getting enough calories. If you're advancing your marathon running, if you're advancing your distance, you should be, for the most part, advancing your calories. And some weight loss is okay, but it's good to monitor it. I weigh myself during marathon training pretty much once a week to watch what I'm doing. It's fine to lose a little weight during marathon training, but it should be well controlled, and you want to make sure that you're not sort of moving in the wrong direction where you're overstepping where you should be. So specific injuries, we'll blow through these real quick, and I'm sure there'll be plenty of questions about it, but I figured I'd just give you a quick little introduction. Stress fractures are sort of the bane of the existence of most runners. If you run enough, at some point in time, there is some reasonable chance you'll get one. Essentially, the theory behind all this stuff is that bone is constantly being rebuilt and turned over every time you take a step walking down the street. Running just happens to break it down a little more. This is a good process because it builds bone mass. These are astronauts in outer space, and what are they working on? A treadmill, because basically they don't have gravity working their bones, and if you don't have gravity, you have to do something to put pressure on your bones. In this case, they're using a treadmill that's got tethers and things to try to mimic that. So it's very good to do what we're doing, which is to stress our bodies out. The problem is it doesn't always work out perfectly. So if formation falls behind destruction, if we're forming less bone than we're destroying, that's where we get into trouble, and that's what a stress fracture is. So the way that I tell most people about it is that bone is basically healing itself, but if it doesn't heal fast enough, it's going to break. And the paperclip model is what most people can understand, is that a paperclip, if you bend it back and forth over and over again, eventually it's going to get weak and then finally break. Bones are not like paperclips in that they can heal themselves, whereas a paperclip doesn't. But it's the same theory, is that you can't break a paperclip just by squeezing it once, but if you bend it back and forth over and over again, eventually it's going to crack. So bones are the same way, except for we just have to stay beneath the level that they're healing. So who's more at risk? Women, unfortunately, especially if they have lack of periods, tend to be at higher risk for stress fractures. Anybody with poor nutrition, especially anyone with an eating disorder, and patients who have a history of osteoporosis, or don't have a history but have osteoporosis and may not even know it, are definitely going to be at higher risk for developing these stress fractures. And that's important because we do have a lot of older runners. Lots of people are running into their 50s and 60s, so that's important to know. Where do we get stress fractures? Pretty much anywhere in the lower extremities. I've never actually seen an upper extremity stress fracture from a runner. That's not very common, but you can get them from baseball and such. But for runners, we see pelvics, hip, knee, ankle, foot. I mean, pretty much anywhere you can pick up an area is going to be a possible site for a stress fracture, although there are some common ones. Taken not in order of commonality, but in order of, well, actually that's more common. So this is a tibia. The one on the right is a upper tibia, lower tibia stress fracture. This one's an upper, and you can see here all the white stuff is basically fluid that's formed around the bone, which is abnormal. And that crack you can see kind of running across a black line is the beginnings of a real fracture. Runners, fortunately, don't break their legs into two pieces like basketball players do on national TV. For the most part, at least I've never seen it. You'd have to be pretty masochistic to do that because the forces that we generate are slow, cyclical forces versus a basketball player, which is twisting and turning rapid forces. So I've never seen a runner fully break a bone all the way, although they get pretty close enough sometimes if you run hard enough and long enough through a fracture that's still there. The foot is a common place for it. This is metatarsal. You can see it kind of lights up there with all that white stuff around it. That's the beginning of a broken bone. And the hip is another common area. Hips are where we get kind of scary. Now this is a high stress area. It's under a huge amount of stress as we walk and run and do everything that we do. And the problem with hips is they have a potential to actually break. And this one, I don't know if you can kind of see from here, but essentially there's, whoops.
Welcome to Open Voice Audio.
So this basically is a crack all the way through the bone where the bone is no longer intact. It's basically broken in two pieces. So the only way to take care of that, unfortunately, is to go to the operating room and put that on there, which is a plate and screws. And that has two downsides. Number one, it's a big surgery that nobody ever wants. Number two is you can actually end up with a dead bone, and the femoral head can die, can lose its blood supply, and then you need a total hip replacement. And for a 23-year-old young runner, that's not a really good thing to have done. So it's one thing that we really are sort of semi-paranoid about in terms of preventing this from happening. So we try to catch these things without ever missing them. So fortunately, most stress fractures heal with simple rest. Unfortunately, this is the one time where I have to tell patients, I'm sorry, but you just cannot run. It's the one thing that you just can't seem to run through. Although the risk of completion to full fracture is very low for most fractures, it's still something that if you keep running on it, it's just going to maintain the fracture to the point that it won't heal. And some fractures take up to 3 months to get back to running. A bad hip fracture technically can get up to 6 months. So if you really crack one, then it's a 6 month to no running. But most everything is going to heal up within somewhere between 6 weeks and 3 months. So running quickly through the common overuse injuries, patellofemoral pain is runner's knee. It's what everybody's heard about if you've done any reading on Runner's World or anything. It's a maltracking of the kneecap and you get too much pressure on the knee. It's pain in the front of the knee, it's soreness, tends to hurt more when you go downstairs, tends to hurt more when you go down hills. And if you're sitting with the knee bent for a couple hours in a movie theater, it tends to be pretty sore. Common disorder, again, it's that overpressure of the knee from forces that are just putting too much stress through the knee through an abnormal knee that was there before you started running. IT band syndrome, very common disorder. What you're looking at is outside of the knee, so pain here on this side. It's usually point tenderness, and it's reflective of this kind of strappy muscle that tends to rub back and forth over the outside of the bone. It creates inflammation, that creates pain, pain creates more tightness, tightness creates weakness, and the next thing you know, the muscle's in bad shape, and sometimes to the point that you can't even run on it. It is sometimes a weak link in the chain. I'm sure our therapy friends will talk to us about this some, but sometimes it's not just the problem with the IT band, but it's a problem with weak core, weak ankles, weak hip flexors, something else in the chain that's sort of screwed everything up. And now this is the area that sort of falls apart. So we do treat this area by itself, but oftentimes it's a sort of the weak link where things fall apart. Big question on knee arthritis. Everybody always asks me, does running cause arthritis? My mom still probably thinks it does, despite the fact I've told her a million times it does not. There is no association between running and premature arthritis. So if you take a cohort of people who run versus people who sit on the couch, you're going to see really no differences in the amount of knee arthritis that occurs. They did a bunch of studies along the way. This was a marathon where they took an MRI scan, which is a crazy sensitive test, MRI people before the race and after the race, and saw that there were no changes to the cartilage. They did not see anything damaging after 26.2 miles of running. Now, the thing that gets confusing is that running really isn't recommended if you have knee arthritis, and that's where things get problematic. People think that they developed arthritis and they can't run anymore, therefore it had to have been the running that caused it, but it's really not. Patients develop arthritis either spontaneously or for other reasons, traumatic injuries and things like that. And once you have arthritis, running is just not going to be the best injury and the best activity. Some people can run through mild arthritis, but when it gets severe, running is just not going to be something that's tolerated by an arthritic knee. So moving down the line, just to finish up a little bit, shin splints, or what we call medial tibial stress syndrome, is a tendinitis. It's an inflammation. It's usually on the lower side of the bottom inner portion of the knee. You can see here on MRI scan, it's lots of inflammation on the bone itself rather than in the bone itself, which is what we would see for a stress fracture. We oftentimes will use MRIs to differentiate between stress fractures and tendinitises or shin splints. Shin splints is typically pain that's mild during a run, but after you run is where things really start to get sore afterwards. And that oftentimes is a reflection of simple things like too much tightness, too much weakness of muscle groups. Plantar fasciitis is really common. It's basically heel pain. It typically becomes better during the run. It's sore at the beginning, but kind of loosens up. First in the morning, stepping out of bed is when it really hurts a lot, and it is something that does occur in a running population as well. Calf tendinitis or Achilles. The Achilles or the calf muscles are where we're getting most of our propulsion from when we run. So basically hamstrings, glutes, and calf muscles are what pushes us forward when we run, and these are high stress areas that are subject to these common overuse injuries, tendinitises and such. There you get pain in the lower calf. Usually it becomes better during a run, but not always, depending on how bad it gets. Last but not least, blisters. You get them on long runs. It's caused by sometimes poor fitting shoes. Sometimes there's nothing you can do about it, no matter how hard you try. But it can be too small shoes or too large. It really, sometimes it's an art form trying to figure out which shoes work best. Prevention, Vaseline, really important. If nobody's told you about it for the long runs, I slather on a combination of Vaseline in different body parts, and Body Glide for different areas can be very preventative. They make lots of different socks, including the double wall kinds, and getting properly sized shoes can prevent it too. Subungual hematoma, which is basically the black toenails that you're going to see lots of runners get. Unfortunately, these are sometimes a fact of life for runners. They can occur if you run enough, and the toenails are going to get beat up. It depends on the size of your shoes and how they occur. Sometimes there's ways to prevent them, but for the most part, they just occur and they're benign. They may hurt a little bit if you touch them, but they don't hurt for running. And it's important never to try to take the toenails off. If they start to get loose, you just kind of let them come off. You don't have to rush to a doctor to get somebody to look at it. I know those look kind of gross. So we're quickly recovering from injury. The therapist will probably go over some of this stuff, but ice and cold packs are great. Ice is nature's best anti-inflammatory. It oftentimes doesn't cost much. It has no side effects in terms of making your stomach upset or anything else. So it can be very helpful, not just for recovering from an injury, but sometimes recovering from a run. The professional guys use ice baths all the time. I take sometimes a cold shower as aggressive as I've gotten, but the ice baths are something that people use a lot for legs afterwards. Medications, anti-inflammatories, everybody knows about Aleve, ibuprofen, Celebrex. They're all effective in trying to treat an area that's gotten too much inflammation. If the body has kind of overshot the mark and produced too much inflammation into an area, an anti-inflammatory can blunt that response and can help out with the healing process. It's not like taking morphine where it just covers up the pain. These medicines actually can improve the healing process. There are topical agents that we use a fair amount. Flector patches and Voltaren gel are both pretty effective for certain areas. In general, the more superficial it is, the more effective that stuff is. Physical therapy, they'll talk about all this stuff at length, but that includes gait analysis, stretching, massage, strengthening, ultrasound, laser treatments, a host of different things that they do, and I'm sure they'll go over it at length. But physical therapy is by far a super critical, important part of most of these, recovering from most of these kind of injuries. Injections we use not so infrequently. Cortisone is a super crazy strong anti-inflammatory that works very locally. So unlike taking an Aleve that goes through every cell in your body but happens to make it to the knee joint where you want the medicine to go, if you put a cortisone shot into an area, it gets the medicine right where it needs to. So it's a local treatment for a localized problem, and it can be pretty effective in terms of depending on what the disorder is. Platelet-rich plasma I throw out there just because people seem to ask about it. It's a technique where we draw blood out of the arm, spin it down, and take usage. It's been hyped up a little more than its real effectiveness, and we're still sort of experimenting with it, trying to figure out who it works for and who it doesn't. The big problem is there are no studies on it showing that it's effective, so the insurance companies don't cover it, and it's expensive. We charge $300 for an injection. Some guys are charging like $900, $1,200 for it. And it's really pretty unproven. So I'll use it kind of as a last bailout approach, but I'm not such a huge fan of it because it does not have great track record of success in the journals yet. So finally, just to wrap it up a little bit, running is kind of supposed to be painful. That's kind of what it is. A lot of times it's hard to differentiate what is really just aching and what is an injury. I mean, there's good soreness and not so good soreness. No real rule of thumb. It's not easy when to tell when to stop training on this kind of stuff, but just some basic general things. I mean, aches are things that we're going to feel. The pain is pretty poorly localized. It's not really sensitive to the touch. It's kind of all over the place. Discomfort that typically improves during a run is usually less than something, is less likely to get into major trouble. Tightness after run is normal. It's physiologic. That's something to be pretty much expected depending on the length of the run. Injuries, on the other hand, these would be pain that's in a very small area. It's pretty tender to touch. That's usually a sign that inflammation has gotten pretty localized, which can be a problem. Symptoms, they tend to get worse with distance or a problem. So if at mile 1 it's a little sore, at mile 5 it's really sore, and at mile 10 you think that you want to rip your leg off, then probably that's an injury that's not just something behind. And pain that really affects walking after a run. If you're really limping after a run and people are sort of saying, how come you're limping? Then that's usually a pretty good sign that that's something that ought to get looked at. So finally, just some quick conclusions. Overtraining, #1 cause of most injuries, and most people, when they go back to figure out what they did wrong, can figure out something they did in their training cycle that was a major problem. Recovery is going to be dependent on a gradual return to running, no matter what you do. That can be really gradual, or it can be somewhat more rapid, but that's going to be dependent on injury. And really take hip pain seriously. It's the one thing that I tell patients year after year. Every now and then, I mean, I'll get a patient that comes in with a bad stress fracture that they just ignored because they thought it was just a tendonitis, and the next thing you know, you're in the emergency room, which is not something I want to see happen. So it's one of the few areas that has a potential for disaster that we get a little paranoid about. Thank you.
Hello. Just to reintroduce myself, my name is Michael Conlon. I am a physical therapist and owner of Finish Line Physical Therapy. I always like to just kind of, talk a little bit about my background. I think it puts us on a level playing field. Not only am I a physical therapist, but I've been doing marathons since 1998, and probably a lot of you guys. I wanted to do one marathon. I put it on my bucket list and did it, and then kind of thought that was it and over with. I kind of, didn't think it was for me, and then about a year and a half later I did my second one. That's really kind of where I got bit with the bug. So I know a lot of you guys are thinking this is a bucket list thing from New York City, but don't be surprised if you find yourself on the starting line of an Ironman on the road. So New York City will be my 24th marathon. And I've been coaching athletes like yourselves since 2002. So I kind of have that coach background, I have a physical therapist background, and then I have the somewhat of that athletic background as well. Like all athletes or runners, you guys eventually, as you get kind of bit by the bug, you'll transition into triathlons, and like I said, eventually the Ironman. So it will happen to most of you. It's not a bad lifestyle to be addicted to, though. I tell you, there's a lot of other things that you can be doing, and this is a good thing. And I always like to commend you guys, because it's hard enough to train for a marathon, but you guys have gone out of your way to do it for a great cause, like Team for Kids, so fundraising money, so that's always a great thing as well. So what I want to kind of talk about today is Dr. Rosen. Without even knowing it, our presentations really complemented each other really well. He kind of talked a lot about the injuries, the specific injuries, and what are some things that you guys want to look out for. As a physical therapist, what I like to do, the way that insurance companies are working nowadays, we often don't have a lot of time to work with you guys as athletes. So I want you guys to kind of have the tools to keep yourself out of our offices, right? I want you guys to go home and be able to do the things that can prevent injuries. And this is an injury prevention clinic, so we're trying to give you guys some of the basic tools. We're about 14 plus weeks away from the New York City Marathon, so you guys have a lot of time. Some of you guys may not have experienced the aches and pains that we experience as runners. Hopefully you guys won't. But I think if you kind of follow some of these guidelines and tools, that your chances of staying injury-free are going to be greater. So some of the things that we want to talk about, and I'm just going to touch on it basically is running form. There's a lot of talk about controversy about this and that. Different types of foot strike and blah, 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 what kind of sneakers you want to wear. And like Dr. Cohen said, it's a lot of it is about what works best for you. You know, it's not you know, the minimalist shoe and this or that. So I'll talk a little bit about running form, things that you guys can focus on. Talk about self-mile fast release, and that's kind of a fancy way for using a foam roller, a grid, a trigger point, a stick. There's so many products in the market now. I want to talk a little bit about dynamic stretching or mobility, strength, and then really a quick slide on hydration. So this is something that, you know, you'll hear, you know, some coaches talk about, you know, the foot strike as far as, you know, being a heel striker, midfoot, or a forefoot striker. There are some coaches out there that really emphasize runners becoming a forefoot striker. And what I do with my athletes is I really try to get them aware of where they're striking on their foot. Okay, so that's the first thing I want them to know. Then I want to know where they're striking on the ground. Okay, so are they striking on their heel? Are they striking on the ball of their foot, more of a forefoot striker, or that mid-between spot, which is called midfoot? Okay. And the way I do that is I get them to often just look at their cadence. I think if you focus on your cadence during some of your runs, you know, we're out there on Saturdays, long runs, and there's not a lot to talk about sometimes. You get to those dead spots where you're a running partner and you guys have talked about everything to boredom. So why not kind of just every once in a while just count how many times your right leg strikes the ground. You don't have to count both sides, just one leg at a time. Whatever your right leg does, your left leg's going to do. The ideal cadence is about 90 steps per minute. So for every minute that we run, ideally we're going to strike the ground about 90 times on one leg. Okay? And what I often see when I do a gait analysis is that most people, when they first start, are heel strikers. And there's a lot of talk about there's nothing wrong with heel striking, and you know, you can go back and forth with different coaches and exercise physiologists and stuff. And I think one of the things that I often hear is that the cadence is really the most important aspect of that. And when you're a heel striker, and I still have not yet to see this when I do a lot of video analysis, somebody that comes in as a heel striker, often their cadence is very low, maybe high 70s, low 80s. And that doesn't sound like a huge traumatic number, but that's for 1 minute. Okay, imagine you're running 10 miles, 26.2 miles. That's a big deal, okay? And one of the things that I think is incorrect about a heel strike is not only are you landing on your heel, okay, but you're landing out in front of your center of mass, okay? Most heel strikers tend to overstride and land out here, so they're not landing underneath their center of mass, underneath their pelvis, where they can absorb a lot of that impact, okay? The other thing I look at when I heel strike, look what happens to my vertical height when I land on my heel. I shrink, okay? I want to be as efficient as possible when I run a marathon, so I want to go that direction, right? That's where the finish line is, okay? When I heel strike, I tend to decrease my vertical displacement, so I first have to pick myself up, and then I can move myself forward. So to over-exaggerate that, you're basically landing, picking yourself up, landing, picking yourself up, so you're very inefficient, okay? If you can do that and maintain a 90 cadence, then I'm okay with that, okay? And as long as you're not having problems and injuries and things like that, I don't force people to become forefoot strikers. I think that's kind of the adverse. It's very stressful. I can't run on the balls of my feet. I think it's very stressful. If I had shorts on, you would see that my calves are not that well developed, and you know, things like Achilles tendonitis and plantar fasciitis and shin splints, those are some things that could lead to injury. So I try to get people to think about their cadence on easy runs. You know, every mile count for 1 minute, how many times your right leg strikes the ground, and over a season. It's not going to happen in one run, it's not going to happen in a week, but it's going to happen over time, okay? So be aware where you're striking on your foot, and then where on the ground you're striking. Okay, does that make sense? Okay. Now, oftentimes runners just go out and run. We have a schedule set up and it says 5 miles. So everybody has to go to the park, and most runners are type A, so they go out there and they run their 5 miles and that's it. How many of you guys grew up playing other sports, soccer or baseball? When I played soccer as a kid, I never went to practice and they just threw the balls out and they set the scrimmage. Okay, what was some of the things that we did? We did drills. We worked on passing. Worked on shooting, worked on kicking, worked on dribbling, worked on corner kicks, you know, all these kind of things. We drill. How many of you guys go to the Central Park when you're running and do drills? Okay?
Not Central Park, but rather.
Okay, that's fine. As long as you're doing drills. I always, I work with a therapist that runs a half marathon in about 1:09. If you don't know what that is, about 5:12 per mile. Okay? And Jason runs for Urban Athletics, and if you ever see Jason in the park, before most of his runs, he's on the bridle path, and you'll see a lot of elite type runners, local elites, and what are they doing? They're on the dirt, They're doing drills like skipping, high knees, they're doing butt kicks, they're doing side shuffles, they're doing karaoke. And all these drills, what they do is help you improve your foot strike, okay? Teach you to absorb the force below your center of mass, okay? And essentially, you know, in order to get faster, in order to improve our performance, we want to increase our stride rate, and then we get to more of the strengthening, and that's how you increase your stride length. But you have to work at that rate. If you watch a Kenyan run, their stride rate is close to 90 steps per minute, okay? But their stride length is massive, okay? It's probably double than most of us, and they cover so much more surface area, but their turnover is still very quick, okay? So essentially, practice makes permanent, okay? And that was a saying that the late Doug Stern, who was a swim coach here in New York City, used to always talk about. If you practice faulty technique when you run, you're going to run with faulty technique. But if you practice drills, okay, and when I do drills, let's just take like a skip. A skip is defined as a step and a hop. So as I step and I hop, and I step and I hop, and I step and I hop, you'll see that I'm landing more on my midfoot, forefoot, and where am I landing in relation to my pelvis? I'm landing below the center of my mass. Okay, does that make sense? I can't skip coming off my heel, okay? I can't do high knees off my heels. I can do side shuffling off my heels. And all those type of drills, they take into account all three planes of motion. I can't run backwards off my heels. If I run backwards, you know, it's impossible to heel strike, but I can run forward and heel strike, okay? So all those drills do is they help you with your cadence, and they help you learn to land below the center of your mass, okay? So example, what I do, and I do them all the time in Central Park, I don't say one thing and do another. I'll go to the park, I live about 3/4 of a mile away from Central Park, and I'll continue my warm-up, and I always joke that the older I get, the longer my warm-ups get. Now I'm probably up to about a 40-minute warm-up before I start feeling good. But I'll just count lampposts, and from this lamppost to that lamppost, I'll do high knees. And then I'll jog from one lamppost, and then I'll go side shuffle. And I'll go maybe half a lamppost right, half a lamppost left, and then I'll jog easy. But I'll continue that 5-mile loop. Okay, so if it's a time, you know, if you have a certain time to do 5 miles, you know, no one said, there's no rule out there that says that you have to run forward the entire time. Okay, so you can mix it up, and I guarantee you, not only will you improve your form, but you're actually going to increase your heart rate while you're doing some of these things. Try doing high knees for one lamppost, and you're really driving your knees landing below your center of mass. By the time you get to that lamppost, you're going to want to do a nice easy jog. Okay? Your heart rate's going to be elevated. Okay? So it's a great way to practice your cadence and landing below your body. Okay? So just like every other sport, you want to try to practice your drills, and that's going to help in your running form. There's a lot other components of running form, but that's one thing I think if you guys start thinking about, and I'll let you coaches handle your arm swing. Excuse me, your arm swing, your posture, and all that other stuff. But I think that's a good, easy tool for you guys to do. So just counting the cadence and also practicing the drills. And there's tons of drills. I'm sure if you talk to, you know, Glenn and other coaches, they'll be more than happy to share some of the drills that they like. Okay. So self-mile fast release, fancy word for a roller. It would be great if your coaches every Sunday came over and offered every one of your runners a 90-minute massage. How great would that be? Okay. We place a lot of stress on our bodies, okay, when we run. It's like sitting at a computer screen for 10, 12 hours a day. You know, if you're sitting with that posture and your shoulders get tight and you get tense, I'm sure you've, you know, stood behind somebody beside their shoulders, they've got all those trigger points and their upper traps, elevated, other muscles up in that area. So we want to try to work that. If our muscles are short, we're not going to be able to go through the full range of motion. Okay? So a roller is a very cheap, inexpensive way to work on that. Okay? I didn't bring one, unfortunately, tonight, but it's really easy to use. You can use it for pretty much any muscle group. I always teach it by just kind of slowly rolling up and down a surface. So if I was working, for example, on my quad, I'd be laying on top of the roller, and I might go up 2 inches, down an inch, up 2 inches, down an inch. I might shear it back and forth, and then I'll kind of do more of an active release where I hold the spot and I'll bend the leg through. Okay? I kind of work in twos. Okay? So you can do that in your quad, you can do that in your calves, and kind of the problem areas that you need to work on. Okay? Whether that be your quads, your calves, your hamstrings, your glutes. And it's just a real nice, easy tool. It's a nice warm-up. You know, we all get out of bed maybe feeling a little stiff from a training run we did the other day or the night before. So it's a good way to start to get a little circulation. It's going to help with flexibility, extensibility, tissue mobility, and indirectly, if you have increased range of motion, it's going to help with strength. Okay, we'll talk more about strength later. But if you have more mobility in your hip joint, okay, you're going to be able to move further through the range of motion, which is going to allow you to increase your strength as well. Okay? And also great for recovery as well. And I typically always advise that it's used before and after exercise. And if you're a yoga person or Pilates, you know, they always talk about breathing. Okay? If I get on a roller and I hold my breath, I'm going to tense my muscles, okay? And I'm not going to be able to penetrate or get to the tissue depth that I want to when I'm rolling. So it's really important to relax, work on inhaling, exhaling, and stuff like that throughout the entire process, okay? But really good tool, simple, inexpensive. And again, like I said, if you can afford to have somebody come over your house every Sunday, I'd highly recommend it. But if you can't, this is something that you have at your fingertips before and after every run. I personally think every runner should have one. Ooh, fancy. So it's blank screen. So I'm going to talk a little bit about strength and mobility. And I'm a big fan of stretching, whether you call it stretching or active mobility, whatever the term that you like to use. And I like to do more of an active type of stretching or an active warm-up. If you read stuff in the New York Times that comes out, you know, you'll see the title that says stretching is bad. You know, so what do people do? They just stop stretching. And my joke is that in 20, 30 years, I'd like to be able to bend down and tie my shoe, okay? I'd like to be able to do that without getting a 3-foot shoehorn that has to, you know, go down and click off my shoes, okay? So I like to do things that are going to increase my range of motion, increase my flexibility, increase my strength, okay? So here's just kind of like a little concept that I think this really kind of helps people think about the idea of what mobility exercise and what stretching does. So if that red circle, okay, it's around the runner, if that represents what range of motion that you have, okay, as a runner, that's your mobility, okay? If that blue circle represents the amount of range of motion that you need to run, okay, then that's when we start running into problems, okay? If I take your wrist and I bend it to end range 90 times every minute, okay, as you run, eventually, what's going to happen? Those tissues are going to start to break down, okay? It's the same thing. Where'd they go? Keep pushing my tissue to the end range, eventually, I'm going to start to develop an overuse injury, okay? But what happens if we have a buffer zone, okay? What happens if that blue line represents what we need to run, okay? And the orange line represents what we have in terms of mobility. So now if I take your wrist and I just kind of bend it mid-range, and I do that over and over again, your body's going to say, no problem, I could do that all day long, okay? So I always give the example of a hip flexor, okay? As I come through, and running is a one-legged sport, I'm not going to be able to do it with one leg, but as I come through with the right leg and go through the swing phase, my left hip flexor needs to be able to extend, okay? Basic range of motion, okay? But if every time I go through, I can't get through that hip because I don't have the mobility because I work in corporate America and I sit all day and my hip flexors are super tight and I can't extend, then what's going to happen? I'm going to have to compensate, okay? Some people will bend their knee to try to gain a little bit more range of motion. Other people will heel off early, okay? And we start healing off early. Our calves and those muscles down below are meant to help us propel, but they want the bigger muscles up top to help, okay? But if I can't get through, now all my weight is being propelled forward off of my foot, and I'm starting to overwork my calf, then the plantar fasciitis and the Achilles tendonitis and the shin splints are all going to start to jump out and rear their ugly heads, okay? So as we talk about mobility, kind of keep that idea in mind, because it's a nice idea just to create a little bit of a buffer zone, okay? Create a little bit more mobility that's needed for the sport of running, and this way your mobility, your flexibility, and eventually your strength will be able to maintain, you know, another 14, 15 weeks of marathon training. So let's talk about another one. Increased capacity eventually equals increased performance. Okay? So what do I like to do? I like to do stretching. I like to do dynamic mobility type exercises. Okay? I like to think about whatever you guys are all runners, so whatever the athletes in front of me, I want to know what your function is. And function is basically, what are your needs and wants? What do you want to do? Okay? If you want to run a marathon, then it's my job to help you run a marathon, right? So I want to do stretching that's going to reflect running. Okay? I want to do things that are going to improve your flexibility and mobility. I want to increase your capacity in all three planes of motion. Okay? What does that mean? Running is a one-dimensional sport. We just move in this direction. we do, but internally our bodies are moving through all three planes of motion. We move forward and back, we move side to side, and then we also rotate. Okay, there's rotation happening with every footfall. Okay? So I want you to go through stretches, and I want you to go through mobility exercise, and I want you to go through strengthening exercise, incorporating all three planes of motion. Okay? It's kind of like when I mentioned before, when I do the high knees and stuff like that. You know, you can do high knees forward. I can also do high knees sideways, and I can do high knees but rotating the hips in and out as well. Okay, so same thing can be said for stretching. So if I were to do a basic, I should do it kneeling. If I do it kneeling, can you guys see? Most of you guys have done a hip flexor stretch. Okay, and the idea is that in order to stretch the hip flexor, all we do is extend the hip. And some of you guys may have just done a static stretch like that. And for me, I already feel a stretch, so that's pretty much all I do. Some of you guys might have gone up and raised your hand up and over. It creates a better stretch. Okay. What I'm proposing is that maybe think about doing it in all three planes of motion, because we know that the hip flexor is active in all three planes of motion. It's going to get lengthened forward, it's going to get lengthened side to side, and it's going to get lengthened rotation. So all I'm saying is when you're doing a hip flexor stretch, do it more dynamically, more active. So the hip is going to go through this motion. So as I stretch, I'll do 5 reps. If I want to do 10 reps, there's no rhyme or reason. And I'll just do an active type of stretch. Each time just increasing it a little bit more, okay? Not only am I flexing the hip, I'm mobilizing the hip joint. I'm working a little bit on my thoracic spine. I'm getting some extension in there. So the body is a unit, right? We can't just isolate individual body parts, right? So you gotta think about the body working together and functioning together, okay? So then I'll go to the side. So if I turn towards this way, and I wanna do more of a side stretch, so the second part of that stretch would be a reach in the frontal plane. So I might reach and go over to the side. And I'm still driving my hip into extension, but now what I'm doing is increasing it in a different direction. What do you do one way, you want to do the other, so I'll do a couple that direction. Okay, and then I'll do some rotations. Again, working on the thoracic spine, working on the pelvis, working on the hip, doing a lot of things all at once instead of just holding it and doing a static stretch. Okay, you'll get a lot more out of it. I do those kind of things as more of a dynamic warm-up as well. Okay, so like I said before, my warm-ups are getting longer and longer. You know, if you work out in the morning, you feel stiff. You might be dehydrated from a workout the night before, so it's good to kind of get out there and warm yourself up a little bit. Okay, so that's one kind of example of a dynamic stretch. Okay, what I love to do is a lunge matrix. Okay, and all that means is you're taking lunges and you're thinking about all three planes of motion. Okay, so I can do a forward lunge, I can do a lateral lunge, and I can do a rotation lunge. Okay, each one of those represent one plane in the three planes. Okay, so just really quickly, I'll kind of buzz through just one side. This is exactly what I do as a warm-up. This is exactly when I coach what I do, and I just think it's a great, not only warm-up, I think it's a great way to stretch, and I also think it's a great way to assess. And you don't have to know anything about your body, but you'll be intuitive enough to know that, wow, when I do that, it's a lot tighter on my left side, or just it feels good, and you might stay there for a couple repetitions. So all it is if you're doing a dynamic type stretch, hold a forward lunge. Both feet are pointing straight, okay? Both heels are on the ground, okay? And then I'll use my hand to create some reaches, okay? And I'll go down and I'll create a reach towards my right foot, okay? I'm feeling a nice stretch in my right hamstring. I'm getting a little bit of a calf stretch in my left, okay? And that feels fine. That's one way. And when I go forward, I want to also go to sagittal plane. I want to go backwards. And now I'm getting a nice hip flex stretch here, working my thoracic spine. Before I flex it down, I'm extending it, okay? And then I'll go side to side, I'll rotate, and I'll rotate the other way, okay? So that's one part of it, okay? Then I'll go into a lateral lunge. So now we're going to change the emphasis to the frontal plane. I'll do the same thing. I'll reach my toe, get a nice hamstring stretch here, getting a little bit of a adductor stretch here. I'll go up and over, and you can see as I come up with my hands, it's driving my pelvis forward, so I'm getting a bit of a extensor or hip flexor stretch on that left side, just a different type of feel. And then from here, I'll go side. I'm getting a huge adductor stretch now on that side. And when I go this way, I'll get a little bit more on that side. And then I'll work my rotation. I'm not only rotating my thoracic spine, but I'm rotating my pelvis and creating a lot of rotation here. Okay? And a lot of you guys will start to rotate, and as you start to turn, your spine will keep going and your pelvis will stay. Okay? In PT, we often talk about the joints that get caught in the middle. The knee is being one, and the lower back is the other. Okay? We have three main areas that we often look at: the thoracic spine, the hips, and the feet. And the knee and the back just tend to be that joint that gets picked on. It's often the victim of an injury. Okay? And then just to go back to that, to finish it off, I would do more of a rotational. Okay? So now I'm really opening up my hips, I'm facing towards my leg, and I'll go through those same reaches forward, overhead, side, side, rotate and rotate, and it's just a different feel of basically the forward stretch. We're just incorporating all three planes of motion, okay? And it's just a little bit different. Now when I go out to run, I feel a little bit looser. Continue my warm-up, then I go to my drills, and I guarantee your body's going to feel a lot better when you're running, okay? And you can do that whether it's your adductor, your inner thighs, your hamstring. If you just kind of think about that concept of all three planes of motion and doing it, you know, kind of, if I was doing my hamstring, ease into it. You know, if I was doing a hamstring stretch, some of us can go down a lot further, okay? We don't need to have 90 degrees of hamstring flexibility, because when I run, I'll talk for me personally, when I run, my leg is never up in the air like that, right? I mean, does anybody run like that? I don't think so, right? So you don't need to. If you're a dancer, maybe you do. But for the sport of running, we need just enough flexibility to create that buffer zone. So that's all this is doing, is kind of allowing you to work within your body range of motion. Think about the sport of running and just create a little bit of buffer zone so you're not stressing yourself every time you run. So that's a nice warm-up, and again, that's what I do with a cool-down. Full disclosure, I have, when I'm training, I often have, not issues, but I have to keep an eye on my right hip flexor. Okay, it's just, I know from doing all the marathons, so I stay on top of it, whether I'm doing myofascial release, but I may come back from a long run, I might do a lunge matrix stretch, and then I might do just an isolated hip flexor stretch. You might have issues with your hamstrings, so when you do it, you might go through the hip flex or the lunge matrix stretch, and then you might spend time working on your inflexible hamstrings. So we all kind of pick and choose. I don't think you need to go through a full body routine every time. You've gone through the lunge matrix stretch, which covers everything, and then if you need to and want to and have time to, you can start to isolate the different muscle groups that you want to work on. Does that make sense? So strengthening. I'm a big proponent. When I'm coaching, it's in my plan, in my program twice a week. It doesn't have to be super fancy. It could be body weight type exercises. It could be done in your living room. It can be done at the park. I just wanted to touch on a couple of concepts. We all know what lunges and squats and push-ups and planks are. And again, I'm just going to say, think about the three planes of motion. If I had everybody stand up right now and do a lunge, probably 99% of you would do the same lunge. You'd go forward and you'd come back. Okay? Some of you guys might step backwards, okay? But no one would go to the side. No one would definitely do a rotation step or a lunge. No one would rotate across their body. We have 360 degrees of mobility, okay? If we just did different lunges, okay, we would increase variance, increase capacity of our workout. This is going to be a lot different and feel a lot different on my leg that's loading and also my leg that's stretching, okay, than just always doing the same walking lunge with the dumbbells by your side, and that's your workout, okay? There's, like I said, 300 degrees of positions, and then you can start varying your feet. You know, if I want to do a forward lunge, but I want to turn the foot in, that's going to be a little different. And if I want to turn the foot out, that's going to be a little bit different. I can go to the side, turn in. So you can do all kinds of different things. You can do the same thing with squats, okay? If I had everybody stand up, most of you guys would go shoulder width. Some of you guys would go wide, and the dancers in the room would turn out. Okay, that would be the sequence. But I can do a lunge here and turn my feet in and do an internal rotation lunge. Okay, I can turn my feet out and do it. I can step forward and do a squat like that. Here, I can get all kinds of creative. I can go wide. You know, you can do all kinds of different things. And again, it's all about increasing your capacity, increasing your variance for the exercise. Okay. I also like to just kind of touch on planks. So, you know, it's great. You know, nice static position. But when during the running gait are we static? You know, if you're static, you're stopped. You're probably at an aid station and you're stopped and you're in pain, whatever. But if you're doing an exercise, I always go back to my rule. It should be in three planes of motion. Okay, you want to create a little bit of a load, you would explode, okay, or unload. So if I was doing a plank, and I'll just kind of go in push-up position, and instead of just holding it, whether it be on my hands or my forearms, I can do things where I'm going down and extending the hips, and I can flex. I can go all the way up to a downward dog if I want, and work in that direction. So I'm working the sagittal plane. I could work side to side. I could work rotation in all different directions. Okay, that's going to be a lot more effective, and again, you're going to start getting your heart rate, your breathing rate up while you're doing that. Instead of what most people, they hold in their static, and then they start going down and down and down, and now they're not really working their muscles anymore, they're more working the ligaments in their lower back and just kind of hanging in their ligaments. Okay, so you can do all kinds of different things with that kind of stuff. And then I always like to go, running, like I said before, is a one-legged sport. So I'll start thinking about, when I'm training a client or giving them a home exercise, trying to get them to work on one leg. So we might start with some squatting with 2 legs, and we'll play with all 3 range of motion. And then I'll go to a single leg with a toe touch, okay? And a lot of runners don't have strong glutes, okay? So I may want to work with the glutes, and intuitively we can just take our hands, and if you have a dumbbell, a ball, a Viper, a kettlebell, whatever it is that you like to use, we can kind of figure out how to load it between the glutes and the quads, right? So again, there's 3 different directions. So if I reach forward and down, okay, and you do that 10 times, and I ask you, what are you working? You're going to say, your butt. Okay? Again, you don't need to know anything about anatomy and physiology, but you'll just know what's working. If I took my hand and went over my head, and I started doing some squats, I'm going to be working my quad more. Still working the glutes, but the emphasis is going to be placed more on the quads, okay? And I can go to the rotation. If I rotated one direction, I would say, what's that working? You would say your glutes. And if I rotated away from that, after 10 reps, you tell me your quad is working more. Okay? And then the same thing with the frontal plane. You can kind of play with that. And then eventually, I'd want a runner to be able to stabilize and balance and do all those in just one leg. You can do all the types of reach instead of just kind of standing on one leg and doing the static, which is fine. Okay? But it's going to be more effective for the sport of running because running is dynamic. So just think about that when you add your strength training program. It doesn't have to be super long. 15, 20 minutes, 30 minutes. If you like doing this kind of stuff, then you can go a little bit longer. As long as it doesn't interfere with your training. People often ask when to put it in. It's really up to you. I wouldn't do a hill workout and then go try to do strength training. I wouldn't do a long run and then expect to do strength training. Either. But if it's an easy day, an off day, more. I kind of think of it more of dynamic stretching, active mobility, active strengthening. Real quickly, I won't go too much of this. Doctor already kind of talked on the importance of hydration. I just use a simple formula I got from a good friend of mine out west. 0.6 times your body weight is the number of ounces of water per day. And I often use the analogy of a grape and a raisin. Okay? If you want your muscles to be more like a raisin or a grape. It's simple. Okay? You look at a raisin, it's dry, it's brittle. If your soft tissue starts becoming like that, more chance of injury. If your muscles are filled with fluid, more supple, they're going to be able to respond, they're going to be able to react, they're going to be able to stretch, they're going to be a lot more healthy. Okay? I won't go into too much about the electrolytes and all that other stuff, but if you're a big caffeine or alcohol drinker, you should always add. So whatever if you do that formula and it's supposed to be about 100 ounces of water a day, and you drink 3 or 4 cups of coffee a day, you should add 10 to 12 ounces of water to the formula above. So pain, to run or not to run. Pain is your body's way. It's a subjective and emotional response. It's telling you that there's potential or actual tissue damage going on. It's a really hard question for some runners to kind of know when to quit, okay, or to modify. Okay. I always ask yourself 2 questions: is the pain moderate to severe to start, or is it increasing as you run? If you can answer yes to both of the questions, you should be doing a little bit of cross training instead. Okay. No one's going to hang a medal on your neck for running 20 miles in Central Park like this. It's just not worth it. Okay, it's just going to lead you to having to modify your training program even more. It's going to have you, not running for a few weeks. And we have 14 weeks. That's plenty of time to train. But as we get closer, you're going to come see a doctor or a physical therapist, and you're going to tell them, I haven't run for 4 weeks. The race is in 4 weeks. My longest run is 12 miles. Help me. Okay. But it's a lot easier if the first signs of these. I've gone to Central Park and I've had a little bit of an ache in my left Achilles, for example, and it just doesn't feel right. And as I go, it continues to get a little bit worse. After 5 or 10 minutes, if it doesn't go away, I stop it. If you're limping to start, it's not going to warm up. That's the response I get from all my athletes. Oh no, it's going to warm up, coach, don't worry. And then 20 minutes later, I see them limping worse than they were before. Okay? So just, kind of feel those questions to yourself and be smart. Coaches aren't often aware of your pain. Especially females, they tend to have a higher pain threshold. They can often hide it, so we don't see the antalgic gait until it gets up to that 8 or 9 out of 10 pain scale. Okay, so be smart. It's a long training season. Like I said, one training run is not going to kill you if you have to miss it. But just think about those 2 questions when you're running, and and be truthful to yourself. If you are having issues, cross-training is the way to go. Again, I'll make an age reference. I personally think all those things are great: cycling, swimming, Pilates, yoga. For example, yoga, I think it's great. It has a lot of benefits to it. I don't do it. I just don't enjoy it. Okay? I'm 42 years old, and I'm going to do things that I like. Okay? There's a lot of things that I can find that can supplement yoga. I can do a lot of flexibility, mobility, and stability things. So I would encourage you guys to pick sports or classes or activities that you enjoy. You can't do yoga 6 days a week and expect to run a marathon. I'll say that. Okay? But you can modify your running, you know, and I won't get too much. I don't like to talk about training schedules and stuff, but you know, some people do run 3 days a week and they do other things three days a week. I definitely think there's a rest day that needs to be built in. But you have to find that balance. You know, the doc was talking about before about finding that balance of what works for you. We're not all, you know, 100-mile runners per week. We're not all 40 or 50 miles, you know. A lot of us are in this to finish, you know. I always joke that you know, we want to finish on the same day we start when we do a marathon, right? So just be smart and know that you can implement other things into your fitness, okay? Because I do a lot of other things. I like to do triathlons and I like to cycle. I don't like to swim, but occasionally I do it. But it's just smart. It's just it's a nice way to encourage our body to have overall fitness, okay? We actually have an anti-gravity treadmill. This is probably the best form of cross-training. It's a treadmill that de-weights you. Okay? We can decrease your body weight by 80%. And it's nice because now if you come in with IT band issues, I can rehab you. We can get you on the Alt-G and say running at 80 or 70% of your body weight. Pain-free. You're just the Alt-G creates a lifting force, so you're still making ground contact, but at 20, 30, 40% less body weight. Okay? As long as you can continue your training program pain-free, then I'll allow you to continue. It helps so much more when I'm rehabbing somebody to have that tool than to fight you on every run. You know, I do some work, I give you some home exercises, you do them, then you go out and you run long, and you come back in and you're flared up again. So it's just a nice tool. It may be for a week, it may be 2 weeks. I've had people that come in for the last 8 weeks of the marathon training and run solely on the Alt-G and still finish the marathon fine. And they're healthy, which is the big thing, right? They're not dealing with an injury that's kind of impeding their performance and things like that. They're healthy. They may not be able to get that 3-hour, 4-hour mark that they wanted to when they first started, but they might be a little bit slower and they have to modify their time goals. Okay? But like I said, you're able to train without interruption. It's nice. I mean, if I know Kara Goucher owns one at home, she does a lot of her volume. She's running 120 miles a week. She's able to jump in that and really reduce the stress on her legs. So it's nice for easy day runs or doing double workouts, but that's really more for the elite type of runners. So what I like to do is we offer, this is for you guys as well, we offer what's called a peak performance analysis. Okay? And what that is a 45-minute functional gait analysis and movement assessment. Okay? And the slogan is prehab, not rehab. Okay? And one of the things I like to think about is it's much better for you as an athlete to know some of your limitations before you start to really get into the heavy mile. It'd be great to know that you can extend your left hip, okay, versus going out and running and then that repetitive stretch. You may get away with it for 4 weeks, 5 weeks, 6 weeks, but if you knew that you need to work on that mobility and you had some exercises to work on, that would be ideal. Okay? So all it is you come in, you get a free analysis. We do a gait analysis on the opto jump, which gives us a lot of great parameters: contact, flight time, step length, stride length, step angle, all these great things that we can see how unbalanced you are as a runner. Okay? Because running is basically dynamic movement, right? And we want to be as balanced as possible. Okay? We go through a movement assessment, and we basically have the opportunity to look at what's going on in your feet or ankles, what's going on in your hips, what's going on in your thoracic spine. Is there any limitations, mobility-wise, strength-wise, stability-wise, that might be creating abnormal movement, abnormal stress that might lead to potential injuries? Okay? And all it is being proactive. Okay? Avoiding injury, trying to reverse the repetitive stresses, and be able to allow you to train throughout the entire training program. Okay? And basically, when somebody comes in and I evaluate them, I want to know what the root cause is. And we often treat injuries, and we have a little bit of PTSA when we talk about the criminal and the victim. Okay? Often we treat the victim and we forget about the criminal. Okay? And the knee, for example, is often that. It's often the criminal when we're talking about overuse running injuries. So it's the area where somebody's having issues. But when I take somebody through assessment, I want to look at, again, their whole body. Their whole body is running. I want to see what's going on throughout the entire movement. So running is a one-legged sport, so when we land on that right leg, for example, there's certain motions that occur that load the body. We essentially load the body. So when I evaluate you, I want to know, can you pronate? Okay? Is it excessive or is it very limited? Okay? How much mobility do you have? And again, I want to know, can you pronate a little bit more? Because I want to know that you have that buffer zone. Okay? So that's one motion I might be looking in your foot and ankle. When you land on your hip, I'll do this side, we have a little bit of flexion. And again, I want to look, not only do you have enough to run, but do you have enough hip flexion to create that buffer zone? Okay? We also, when we land, the hip actually goes through moving in the frontal plane, so when we land, your hip adducts. Okay? So do you have that ability to move that hip even further than you need for the sport of running? And then I'll take you through and I'll do the rotation and I'll look at the thoracic spine. Okay? So really overlooked is that spine area. We create a lot of movement and power out of that. Is I want to know when we come through this way and the pelvis starts to rotate away, do you have the ability to rotate? And if so, do you have the ability to rotate more than you need for the sport of running? Because when we run, your pelvis goes one direction and your upper body goes the opposite. When we walk and run, we don't do that, right? It's that opposite arm, opposite leg. It's as the left leg goes forward, the left arm comes back and we create that opposite rotation. Okay? So the shoulders and the pelvis always move in opposite directions when we run. So I want to know, do you have that ability to do that? And then we'll basically take it through and look at the unloading phase. So as I land and then the other leg starts coming through, this is the leg that's going to unload or propel me forward. So can you extend? Okay? Can you now in the frontal plane, can you abduct and then can you rotate? Okay? And then the same thing with the spine. Okay? So just looking at all that stuff, and the foot and ankle, we often see people with plantar fasciitis and Achilles tendonitis through because they have lack of mobility in that hip, for example, they can never get out of that pronated position. Okay? And when we pronate the foot, it stays very loose and floppy. Because when we land, it wants to be a mobile adapter. It wants to be able to adapt to whatever surface we're running to. But when we start to push off, the foot locks up and we propel off of that foot. Okay? But if I can't do that, then all those tissues are overstretched. For example, the plantar fascia stays in a very stretched position and the foot's flat, and then I'm just going to start to really stress it. And again, that's the criminal and the victim. Right? The victim was more the plantar fasciitis and the hip. So we often get people that come in and we're working on their hip and they're like, but it's my plantar fasciitis. I might have to treat locally, but my mind is always thinking globally. Okay? So I have to look at the entire body. I think that's all I got.
Okay, we'll do a quick question and answer, by the way, for those of you who don't know, because I don't recognize all the faces. I'm Coach Glenn. I'm one of the coaches for Team for Kids. And, no. Oh, thank you. No. So let's, do we have any questions here? Here's Dr. Michael, over here. Yeah. And you want to direct it to an individual, you can.
Anyone.
Okay.
I've yet to be able to work out with the team. So I have a question about warm-up and stretching. Do you recommend doing a light half-mile, mile jog, and then doing static stretching, dynamic stretching, and then doing the workout?
Well, should I just answer?
Yeah.
I'm just to say what we do, and this is good for our national or international audience actually, who's out there who's going to be watching this. At Team for Kids practices, what we do is we start with a dynamic warm-up, and beforehand you should always do a dynamic, not a static stretch. Where we were younger, at least when I was younger, we used to always just do this. The difference is we're doing a quad stretch, be just holding and just hold. So if we're doing a quad stretch today, we would do motion in it. And then we go out for a run. We used to do a little bit of a warm-up. Again, we have people who are coming from work here, and we're in a confined time space, so we realize we do have to keep practices more than a minimum. Now that said, if you want to add, if someone's on their own, they do have more time.
In a perfect world, I think doing some kind of active mobility type stuff is great. Like I said, I typically start off. I'll be in my apartment. I'll just do an active lunge matrix, and then I'll go out and I live about, like I said, 3/4 of a mile. And my run to the park is very much like this. It's very slow. And then if I have a workout to do, it depends on how much more mileage I have to do. And like I said, I make the joke earlier, but I do front load my warm up and I do run easy for a couple miles. That's, I have the time and the ability to do that. And then I get into my workout and then I would do a nice easy recovery and cool down. And then I would kind of finish with my lunge matrix stretch at the end when I get back to my apartment.
Doctor?
Yeah, I do something similar. I mean, I tend to, at least twice a week, do a good, like, 20 minutes of pretty aggressive dynamic stretching where I just really sit there and concentrate on doing them. Most of the stuff is usually showing there, lunges in all different directions and all different kinds of stuff. And then for my weekly runs, typically going to wake up and do a light sort of staticky, sort of dynamic-y stretch just to kind of loosen up, and then take a very light, relaxing jog. I'm a half mile from the park, so I'll take a nice half-mile run and just take it easy. And then when we get to the park, we typically do pickups. So I'll start off running on the slower side and then start picking up the pace so that by the end we're running at the pace that we want to be at. So I'm a big fan of slow warm-ups rather than just getting out there and killing it.
And to either one, would your warm-up differ on a day of an easy run versus either a pre-race or a day when you're doing a harder run like a tempo or intervals?
I mean, I think it depends on your time scale. If you're running a race, sometimes it's hard to really get a good warm-up. You're taking a subway or whatever to the race, and then I try to get a little, short jog warm-up when I can, but it's not always easy. You got to stand in the corral for an hour beforehand. In the marathon, not all of us at the marathon are going to get the advantage of being able to go run around the track like the pros do. Most people are standing in freezing corral. So, yeah, I mean, I think races you have to do what you can, but there's limited amounts. And I frequently in a corral will sit there and do a bunch of dynamic stretches while I'm in the middle of a corral trying to get a warm-up, and I'll try to get my muscles working as best as possible. But for most runs, I try to get a nice, easy warm-up going and then start getting into whatever it is I'm doing, whether it's speed work or long runs or whatever.
And just to let the Team for Kids members know, on Marathon Day, we do a Team for Kids group stretch in our private area. The day of the
Spoiled you are.
One of the perks of being part of Road Runners, so we do it right outside our private tent.
I wonder if people that do injury prevention clinics get invited to those private.
Other questions? Did you have one, Lisa? You started?
No.
Okay.
Yes, I have one for the doctor.
Yes.
You mentioned on the presentation that you have to watch out on weight loss. When is that critical, or is there a threshold you have to watch out about?
I mean, weight loss is going to be very individual. I mean, myself, I know where my ideal weight is, and in practice, I know where I want to be at marathon. And I can't maintain my ideal running weight all year long. So during the course of marathon training, I'm watching my calories very closely, and I'm watching my weight sort of like slowly taper down, and then before the race I kind of plateau it for usually about 4 weeks into it, and then right at the race it peaks up a little bit. But again, I'm very careful because I know sort of where I am and where I think I should be. If you start off a marathon training program and you're significantly overweight, then it's not unreasonable to lose some weight during the course of training. But it's definitely a mistake to use marathon training as a major weight loss tool and decide that you're going to just restrict your calories and eat nothing while you put on heavy miles, watching your weight go. And that's definitely a good recipe for overuse injuries, whether it's muscular injuries or even stress fractures. So I think the key is to know kind of where you are and to plot out where you think you should be, and make sure that in general is not like a rapidly plummeting course where the marathon is towards the end of it. It should be losing some weight as you go, but then sort of keeping it under control and tapering it towards the end so you're not getting too thin.
And let me ask Michael, as a coach, have you seen the opposite? People come to you and say, Coach, I'm already up to 30 miles a week and I have not lost weight.
You often see.
Can you quickly touch upon that? We have a lot of questions, but touch upon the opposite side.
Yeah, it's probably the unfortunate thing that a lot of runners, a lot of us are on the thinner side, and we can sometimes eat what we like. Some people that aren't as fortunate, you can't take running as a license to eat as much as you can. You often see people that come to Saturday practice, they run 8 miles and 10 miles, and that's a fantastic achievement. When you break it down, you didn't really burn as many calories as you think. So going to brunch, and I've been witness to brunch before, and I've partaken in several brunches, okay? But when you do that on a regular basis and you run, 4 or 5 miles and you go home and eat the kitchen sink, when you're eating or consuming more calories than you burn, the opposite is going to happen. So just be cautious of that as well, because it is, you really do want to, nutrition is a huge part of the energy that we feel and how we perform. So watching what you eat, trying to eat healthy, and I think I heard you guys had a nutrition clinic already, right, earlier. So nutrition, I'm a big fan of eating well and eating whole foods and not eating processed foods, but that's a topic for another day. But just, be mindful, especially if you are someone that may want to think about losing a little bit of weight while you're training, that it's not a license to eat whatever you want.
Okay. Other questions? Yes.
In your presentation, you said to watch out for hip pain. So what are some of the warning signs for hip fracture besides, normal pain? What if you get pain but it goes away? Like, is that a precursor to it?
Sure. I mean, basically, if you lump it into three categories, or there are sort of three main causes of hip pain in runners. Basically, flexor problems, so problems up in the front here, trochanteric bursitis or IT band problems over here, and gluteal problems back here, butt muscle problems. Those are the three areas that we're going to see forces get concentrated. The problem with hip stress fractures is they can kind of look like almost any of them, depending on the severity of them. I mean, I saw a young girl today who was running and basically came in on crutches because she was limping so much that finally her friend told her she had to go to the urgent care center and get a pair of crutches. She got a pair, and I sent her straight for an MRI. She's probably in the scanner right now, and I bet reasonable good amounts of money that she's got a stress fracture just based on the fact that it's hurting so much. It hasn't been improving with Advil and rest. She hasn't run for 4 days, but she's still walking with a limp. I mean, those are all warning signs that something bad is happening, and that's something that definitely needs an MRI scan to be sure about. So if, in general, if a hip is pretty tender in one spot, that's actually kind of a good sign because that usually means it's muscular and it's more superficial. If it's a deep pain and it hurts with loading of the hip, stepping down on it, that's not a good sign. That tends to be more of a bony problem. But it really is not easy to tell. A lot of times, I mean, I've seen some pretty rip-roaring hip tendinitis that I was sure was a stress fracture. Somebody came in, could barely walk, and got an MRI. It was totally normal. So, my index of suspicion is always high when I see somebody who's got pain that's not getting better and that they're walking with a limp. That usually means they need an MRI before they need a trip to see him. And frequently, I'll get calls from the therapist all the time. I'm seeing this so-and-so. She was referred to me directly. She's never been seen before. Can you arrange to get an MRI scan? Because I can't treat her because she's got hip pain that I'm worried about as a stress fracture. So it's it goes hand in hand. Everybody kind of needs to keep an eye out for it.
Any other questions? I'm sorry.
Thank you.
Any other questions?
I actually have a question for Dr. Rosen. I'm happy you talked about the NSAIDs and anti-inflammatories. I get this question all the time with our patients. What do you advise as far as, like, I've been taking Advil, how often do they take it, or how many days should they take it, and when do they stop if it's not doing anything?
Yeah, I mean, my general rule of thumb for anti-inflammatories is I don't think they've got a real active role for somebody who's just marathon training, who just wants to, they take a nice long run and their hips are sore, so they pop a bunch of Advil to kind of make the process better. So I personally don't use them as part of my training regimen unless I think something's going wrong. So if I have done a nice long run and the next morning I wake up and I think, wow, my calf is significantly more sore than I think it should be, then that's a time where I'll sort of blast myself with anti-inflammatories for a couple of days. I'll back off on the training, I'll do more active stretching, and then see how things go. And then depending on how quickly it improves, that's what I'll use to titrate the stuff. So I'm not a big fan of using it prophylactically, and I don't use it, I don't take 10 leaves right before a marathon and think that that's going to get me through it. So I don't use it too much for that kind of stuff. But I think it's really good if you're trying to patch up something that looks like it's on the edge of turning into something real, and an anti-inflammatory can kind of sometimes bring it down a notch where you can get it under control before it gets out of control.
Yes, please.
So the trainer at the gym actually told me, he said, if I'm going to take Advil, to take it after a run and not before. What do you think?
Well, I mean, I think it depends again on what you're treating and where my calf has been sore, and I know it's not bad enough that it's getting into major trouble, but I think it could use a little help. Then I might take an anti-inflammatory prior to a run and afterwards. I don't really use it on race days. There's two concerns. One is that you're sort of covering something up that potentially could get into trouble if you're not careful. But there is some issue with sodium balances and anti-inflammatories during long distance runs. So it's not a major concern. But there, we here at the race we don't give out anti-inflammatories. We give out Tylenol at mile 5. If you need to stop into a medical tent because something's hurting, they'll give you a Tylenol, but they will not give you an anti-inflammatory. Same thing at the finish, because there is some issues with sodium balance that can happen with long distance runners. So I don't really use them too much in terms of that approach, but I think that there's not a major harm for most distance runs of using one beforehand. For long runs, probably not such a great idea because of that concern for sodium issues.
Any other questions? Okay, once again, on behalf of the kids and New York Roadrunners, I'd like to thank Dr. Rosen and Michael Conlon from Finish Line, and I can actually just say, personally, I have been to both, and I unfortunately can recommend both, but I wish I could say I haven't had to be to both. Also, up here as one of the coaches, it was meant to be one of staff. For those of you whose faces I don't recognize, I'd like to really encourage you to come by practices. Use the coaching staff. Use us to run in a group. It's always bad to run a group. So come down to practices. We go Monday, Wednesday nights at 6:30, and Saturdays we alternate the different spots. You can just find out. Again, I'd like to thank them both, and good luck, and see you all out there on the roads.